My name is Alyssa Peterkin. I am an internal medicine doctor who specializes in addiction medicine. My main clinical care settings include both inpatient and outpatient, where I care for people who are experiencing a hospitalization related to their substance use or are engaging in treatment for the first time. Recovery looks different for everyone. The Substance Abuse and Mental Health Services Administration's working definition of recovery from substance use disorders is a process change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Simply put, by author Maya Salovitz, recovery is about people and what matters most to them. Abstinence is not the only goal. In my clinical practice, when a person who drinks alcohol presents for care after being diagnosed with unhealthy alcohol use, using one of the evidence-based screening tools such as a single-item screening question, or an alcohol use disorder with the Diagnostic and Statistical Manual of Mental Health Disorders 5th edition, also known as a DSM-5, the first question I ask is, what do you hope to get out of this visit? And the second question is, what are your goals as it relates to your life and alcohol use? Often these questions are sufficient to come up with a treatment plan. However, sometimes patients may require some additional prompts. For example, I may follow up by asking, is your goal to decrease your alcohol use? To stop drinking alcohol? Or to drink safely, reducing the harms associated with alcohol use? Goal setting is essential and can be empowering. It allows patients to feel heard and creates the opportunity to develop a treatment and recovery plan that uniquely meets the needs of the person you are caring for. It can also be a tool to measure a patient's progress, providing concrete evidence around what is working and what may still be impacting progress. As mentioned earlier, complete abstinence does not have to be the goal. It is important to meet each patient where they are in terms of their readiness to change their relationship with alcohol, while leading and supporting them towards change. Maintaining a non-judgmental approach and respecting patient autonomy is key, even when there may be discrepancies between a patient's stated goals and the health risk. In these situations, ask permission, share clear advice on their health, and work with them to reduce harms. Centering the patient using motivational interviewing as a foundation for the treatment planning are important. Let's think about ways to achieve the following goals. We can do so by reviewing some scenarios. Your patient's goal is reducing the amount of alcohol that they drink. To customize their treatment plan, you clarify their current pattern of use and how much they want to reduce their use. They tell you that they're currently drinking 3 nips after work, Monday to Thursday, and 1 bottle of wine on Friday, Saturday, and Sunday. They also share that at this time, they do not think that they will be able to eliminate alcohol during the weekdays because it helps relieve after-work stress. Your plan could include a medication for alcohol use disorder, such as daily naltrexone, which has demonstrated efficacy in reducing number of heavy drinking days. You may ask your patients to share some non-alcohol activities that help reduce stress. If they cannot identify any, then suggest some exercise or other stress-reducing activities, such as knitting, board games, or meditation to alleviate stress. You may want to share a list of coping strategies. You can discuss engaging other key individuals in the person's life to help support their goals. Check in with the patient regularly, monitor medication adherence, and provide positive reinforcement for changes, no matter how small or incremental. Here is a second scenario. Your patient's goal is to prevent a future DUI, driving under the influence incident. You ask the patient to share some of the details preceding the decision to drive after drinking and ways they may prevent this in the future. This is also a great opportunity to ask questions around what they know about how alcohol impacts impairment and decision making. You learn that the patient went to an office party that evening. In response to brainstorming options for preventing a future DUI, the patient explores the possibility of not driving to these parties in the future and instead arranging for a friend or family member to provide transportation to and from the events. You acknowledge your patient's ideas for change and thank them for sharing and empower them to make this change. Change can be overwhelming. Remind the patient of their chosen goal and recovery plan and support them through that change. For example, identifying which friend or family member to call. You can offer other harm reduction approaches that they may not have considered, such as limiting the number of drinks consumed at these parties, consuming a glass of water prior to drinking the next alcohol-containing beverage, transitioning to non-alcohol-containing beverages or mocktails later in the evening, eating food while drinking, or having a buddy or accountability partner to monitor their alcohol use. In this final scenario, your patient shares that their goal is abstinence due to the severe health consequences of their alcohol use, and they would like to stop drinking. You may want to clarify if they've experienced any period of abstinence from alcohol in the past. You should invite them to share what it would look like for them to abstain from alcohol. Does this plan include treatment, support groups, or medications? It is also helpful to understand the why someone is drinking and addressing the root cause. Explore what has been the biggest obstacle impacting their ability to abstain. Have they experienced acute withdrawal symptoms or protracted alcohol withdrawal symptoms, such as insomnia, cravings, or mood disturbances? Who's in their community? What does their support look like? Do they have friends or family who don't drink? If this is your patient's first attempt at abstaining from alcohol and they are not sure what the next steps are, you can recommend a medication for alcohol use disorder such as naltrexone or acamprosate. You may suggest mutual support groups such as Alcoholics Anonymous, Smart Recovery, or perhaps local recovery groups held in your community or health center. If alcohol use is related to trauma, mental health, physical health, or other life stressors, include a plan for addressing those as well. Check in with the patient regularly and provide positive reinforcement for changes, no matter how small or incremental. If this is not your patient's first attempt at abstaining from alcohol, explore some of the reasons for return to use or challenges abstaining and create a plan with the patient. To wrap up, creating a treatment plan that meets your patient's needs and goals is important and involves engaging patients in the treatment planning. Consider the whole person. Treatment should be realistic and pragmatic. To end with a quote from Dr. Nora Volkow, director of the National Institute on Drug Abuse, as long as treatment is only regarded as successful if it produces abstinence, then even one-time lapses can trigger unnecessary guilt, shame, and hopelessness.